pleasure to introduce Congresswoman Dina Titus, who is going to talk to us today about a really great award that we have achieved here at the VA Southern Nevada Healthcare System. Congresswoman?
Thank you. Well, thank y'all so much for joining us. Thank you, Director Kearns. It's just my pleasure to be here. This is one of those things that makes you really feel good, that you just want to brag about, that you want to tell everybody what good things are happening here. You know, and in today's world, there's not a lot of that kind of news, so it's a delight to be here. Dr. Commodore, I saw you earlier. Yeah, thank you for all your service here. Coming into the hospital this morning, I just ran into 2 or 3 veterans who knew me, which I think is a good thing, but they were all just saying how great the service is here, how seamless it is, how proud they are of this hospital. So thank all of you for what you do every single day, and those who are veterans, especially thank you for your service. We're here today to announce an award that the hospital has received thanks to all its really hard work to address the special challenges and needs of certain veterans in the LGBT community. There is a category, a form you have to fill out, measures you have to meet, standards you have to accomplish that's very rigorous, but it shows that the hospital is accommodating, is appropriate, is staffed and resourced in order to give the best kind of care to LGBT veterans. You know, I say it's not your grandfather's military anymore. We've got a lot of LGBT veterans, and they deserve the same kind of care as anybody else. So I am so proud that the hospital, under Director Kearns and with the really leadership of David Jenkins, met those standards. You know, you don't have to do this. It's not something that's required. It's something that's voluntary, and that makes it that much sweeter. And the number of hospitals were surveyed here in the state of Nevada to see if they do meet the criteria. And you know what? The VA hospitals were the only ones that got 100%. And category, and David's going to tell you about what all those categories are. And so we are classified here as a leader in healthcare for LGBT community. So I couldn't be prouder, I couldn't be more appreciative, and I just think this is wonderful, and we need to brag about it because you are setting the gold standard in so many ways, and this just adds one more notch to that list of accomplishments. So thank you for all you do. Thank you for being here. And I'm going to let Director Kearns talk a little bit about it, and then David will give you some of the details of the program, and you'll see just how rigorous it is and just all the good things that you're doing on a daily basis. So thank you very much.
Well, thank you, Congresswoman, and thank you for your unwavering commitment to our veterans here, all of our veterans. And we're so proud today to be publicly announcing this award. And we're so happy that you could do it for us and recognize this, because when I came here a year ago, Congresswoman came out and met with me, and she handed me a letter and said, I would like for you guys to go after this. And we said, okay. Because, interestingly, my last station, we were 100% or 2 for LGBT. So I said, yes, we're going to do this. We got a group together, and we worked on getting this. It was quite a trip. And David's going to tell you about what it took to get us there. But I want to personally thank David Jenkins, Robert Johnson, and Quentin Hart for their really hard work on putting this together. There was a lot of long hours. And I want to thank other employees that were involved with this, because it took some policy changes and some education and a little bit of everything to get this so we could make the leader in healthcare equality. So I just want to thank everybody again. This was just a team effort, and that's what we're about. We do things in teams and we get things done. And this is just another example of how we do things at VA Southern Nevada Healthcare System. And I want to thank, again, David and Quentin and Robert for all they've done with this. I'm going to let David come up and tell you about what it took to get this award, and then we'll close out with him. So thank you.
All I can say is, wow. I want to thank not your grandfather's military anymore. Things have changed, events have changed, times have changed, and the VA has changed along with it. I also want to thank Ms. Kearns for being such an ally. Every time there's been any type of questions or whatnot in regards to completing the Healthcare Quality Index, the HEI certification, we were able to go to her or to Robert Johnson, her assistant, and there's never been a qualm or a scuffle, or she's always been there 100%. So from the LGBT community and from the LGBT veteran, thank you very much. I appreciate that. This certification means a lot, and it means a lot not just to me, but it means a lot to the LGBTQ veterans to know that they have a healthy, safe environment they can come to, that they know that they're not going to be discriminated against, that they have people there that care about them. They don't have to talk behind the scenes or behind somebody's back. And if they have questions, they have somebody here that they can talk to. As the director said, this has been many, many hours of hard work. The amount of work that it takes, in regards to some of the different areas, there's a total of 9 different sections that have to be met in order to make leadership status. And some of those are individual policies. You have to have a policy in place that specifically designates gender, transgender patients, as well as other patients with their own knowledge, with the staff's knowledge. You have the policy in place knowing that there's not going to be any discrimination, that there is resources and there is recourse. You have to have gender-specific bathrooms. Restrooms have to be made available, single-stall restrooms to people. Staff needs to be trained in proper ways of discussing transgender LGBT issues. So if a person says, my husband, in this case, my husband is here with me today, when I say my husband, they know what I'm talking about. And that means more to me than anything I could ever say. Robert Johnson, again, thank you so very much. It's unbelievable. The amount of work was just unbelievable. Human Resources, Jason Cleveland, I'm not sure if he's here right now. I don't see him. But he did a lot of work, not just for the veterans, but the standard also involves employee relations, employee status, employee benefits, insurance benefits. Our Human Resources Department took the lead on that, making sure that all the LGBT employees have status available and things available. The entire Media and Public Affairs Office, they've been handling to them, getting the information out, getting information out to the media about this event, reaching out to helping us to locate resources from outside the VA that we can partnership with. That they've been with partnerships. We've got a brand new partnership with the center, which is the LGBTQ center here in town. Holly Reese, who wasn't able to make it today, but she's been a wonderful asset. So if a person is LGBT and is a veteran, but their husband or their wife, whatnot, is not, and they have questions or they need counseling or services, we can refer them over to the center, and they know what we have, so we can work in close partnership with them. So to the center, I say thank you so very much. And I'm going to get emotional. But last but not least, one person I have to thank is my husband. Might stand up, please. We both met in the Navy almost 24 years ago. And I love him with all my heart. I love him just as much today as I did before. And he has been there through this, and he's helped me through the long nights getting all the paperwork done and all the other kinds of stuff done. And then for his support. And I do have to say thank you also to, is Thea here? Yeah, Thea Johnson. No, right here. Right. Oh, there she is. I'm sorry, I was looking back at this. Thea and Lakita are phenomenal. They are our patient advocates. They are our first line of defense. If a patient has a question or a concern or an issue, we're always told to go to the patient advocate. Well, there are 2 main patient advocates that our LGBT veterans can go to, and they can feel comfortable. The patients can feel comfortable talking to them, and they know to contact me for whatever resources we have available, and we'll get them all taken care of. So again, Thank you all so very much. I appreciate this more than you know. And thank you again for your time. And Congresswoman Titus, thank you so very much. This means the world to me. And Director Kearns, thank you so very much.
We're very proud. Well, thank you, David. That's nice you found somebody to put up with you for 24 years. That's quite an accomplishment. Well, I just want to say one more time how much I appreciate the hospital staff and leadership taking this on, because it's not something you have to do to get this award. It's something that they were willing to do and wanted to do. And that's why I just love this hospital and the service that it provides to our veterans. They don't just do the minimum that's required. They do the maximum. They go out of their way to be a partner in this community, serving all our veterans, women, LGBT, World War II, Vietnam, all our veterans. Because they wear the same uniform, they fight for the same flag, and they deserve the same services that each other sacrifice so much to earn. So it's my pleasure to be part of this. I thank all of you for coming. And we got to go out and just brag about it. We're number one, I'd say. We are number one in the state. So thank you very much.
Invite everybody that we have some refreshments in the back, and again, thank you for everybody for their hard work. Oh, you have one?
I was going to say, if anyone whoever wants to come up, we'll take a picture here, maybe with the group or whoever's interested in coming in front of the podium.
Terrible. She said hello.